States Healthcare Foundation (AHF) has trained women living with Human Immunodeficiency Virus (HIV) in FCT communities and prevention of transmission of the disease to their infants. Dr. Eche Ijezie, AHF Country Director, said the organization also trained some mentor mothers in Anambra, Nasarawa, Benue, Kogi, Cross River, and the FCT to support and counsel HIV-positive women on overcoming stigmatization and accessing healthcare.
The Mentor Mother program for AHF is being conducted across all the states. Anambra State, here in Abuja, FCT, Benue State, Cross River State, Nasarawa State, Kogi State, Akwa Ibom State. There are 7 states in all where we work as AHF Nigeria, and we are creating a critical crop of mentor mothers across these 7 states who have benefited from the cascade of PMTCT with good outcome, and they are serving as champions, and they are serving as an encouragement to other women in the community that they have benefited experientially from this and with good outcome, and they are willing and encouraging others to come forward to access care and treatment and ensure that their babies are HIV negative. If someone comes forward and says this is his or her experience and is willing to talk about it openly, and the person is living well, doing very well, that in itself serves as an encouragement to other members of the community that there is nothing to be afraid of, there is nothing, it's not a death sentence, and we want the babies that are born to be HIV negative. And so we're happy to have this critical crop of mothers, and we're training them and empowering them and ensuring that they're working in the communities where they live.
Also, Steve Aborishade, Advocacy and Marketing Manager, AHF Nigeria, noted the gaps in the HIV delivery system, stressing the need for treatments to improve having children born with HIV in the country.
It's important that we bring these women from the community where they live themselves. There's a facility that across Abuja. So speak to the women in your community, get them to come to antenatal care. Once you attend antenatal care, it's compulsory. You'll be tested for HIV. Once you are positive, you get on the treatment program immediately. And that guarantees that your child will never have HIV.
Also, Mrs. Christy Awuno, AHF State's Nursing Coordinator, emphasized the role of mentor mothers to include support during antenatal care, HIV testing, care and treatment services for newly discovered HIV-positive pregnant women.
They are positive mothers who were once pregnant and had their babies, and their babies are negative. So they have had this experience before, and they can use this medium to encourage other positive pregnant women in the communities to ensure that there is reduction or total elimination of mother-to-child transmission of HIV.
Mrs. Grace Ongbiang, one of the newly inaugurated mentor mothers, said she adhered to the medical directives and treatments which prevented her from transmitting the disease to her children.
My last baby is about 17 years, and I passed through PMCT and she is negative. And I was so happy, and when I see women that are pregnant, I try to get close to them so I can know whether they can be able to go to the clinic to know their status. And in the community where I stay, I work with people. I get close to them to try to know, especially women and children. When I see their situations, like we are trained, you can pick 1 or 2 things to make you know that yes, this person is positive. Even by the nerves, we know.